This is the patient information leaflet for the study with the title Maximising Equity and Accessibility of Acute Stroke Care Pathways in Ireland, a focus group to understand public awareness and response to stroke. Part 1, describing the study. Why is the study being done? We wish to understand stroke awareness in the general population in Ireland so that we can plan and organise public health campaigns and stroke education initiatives that are appropriate and effective for the Irish population in general and for high-risk populations in particular. Who is organising and funding this study? This study has been organised by a team of researchers who work at Beaumont Hospital and at the RCSI, University of Medicine and Health Sciences. The study is funded by a grant from the Health Research Board, or HRB, and is part of a postgraduate qualification, or PhD, for a doctor who works in stroke care in Ireland. Why am I being asked to take part? We wish to talk to a range of people who have never before been directly affected by stroke. We aim to recruit a diverse range of perspectives across age, gender, geographic location and ethnicity. We are interested in your views. Your insights and opinions are very valuable to us, and we believe that hearing from you will help us improve public awareness of stroke in future. How will the study be carried out? The research involves gathering groups of 4 to 5 people together for an open discussion about stroke. These discussions are called focus group discussions, or FGDs for short. Each focus group discussion will last about 60 minutes and can be held in person in a location that suits the participants, or online groups can also be arranged if that's more suitable. In total there will be 7 focus groups, but you'll only be asked to participate in one group. The discussions will be facilitated by the doctoral researcher, who will explain the study at the start of the group discussion, and the discussions will be relaxed and open in the spirit of a shared learning experience. What will happen if I agree to take part? Once sufficient people are available, a date, time and place, including online, will be arranged that suits all participants. Efforts will be made to suit all participants as best as possible. A focus group discussion will be facilitated by the researcher, that is, she'll act as the chairperson and will get the conversation started and flowing. You will not be under any pressure to speak unless you wish to contribute. You'll not be signalled out for any specific questions or answers, and the goal of the focus group discussion is to have a free-flowing chat on the topic of stroke. The researcher will introduce the study and establish some simple general ground rules for the focus group that aim to make the experience an enjoyable one. In focus groups, it's important that everyone has the opportunity to participate if they wish, to say as much or as little as they want, and to listen and to be listened to. So turn-taking and conversation and confidentiality are key elements in a focus group. The focus group will be recorded using a voice recorder for in-person focus groups, and the reason for recording the discussion is to allow a transcript or written record of the discussion to be typed, so that the researcher can later analyse the discussions for patterns in the conversations across different groups. But your individual identity will not be identifiable in the final typed transcript. If you agree to participate in the study, you'll be asked to sign a consent form and provide your contact details. We'll also ask you for the following details: your age, gender, marital status, level of educational attainment or age of school leaving, employment, smoking history, though you can choose not to provide these details. What are the benefits? While you may not benefit directly, it is hoped that by learning from your perspective, the results of this study will help to inform the content and rollout of public awareness campaigns for stroke in the future. We want to improve how stroke awareness campaigns are planned and organised to make them targeted, impactful and effective for everyone, so that people have the best possible outcome after their stroke. What are the risks? Research involving focus groups are low risk in their design. However, discussions involving topics related to health and healthcare services can be emotive. So even if you've no direct experience of stroke, it's possible that you've experience of healthcare challenges in other areas or fields. So if you experience any distress during or after the focus group, you can speak about this to the researcher, you can stop for a break temporarily, or you can withdraw from the study altogether. Your distress will be acknowledged and supported. What if something goes wrong when I'm taking part in this study? It's very unlikely that anything will go wrong as a result of participating in this study, as it involves a format of voluntary and open conversation. The researcher will contact you the day after the focus group to check on your well-being and answer any questions you might have. The contact details of the researcher are at the end of this form, and you can contact her until the end of the study should that be necessary. Is the study confidential? Confidentiality is very important in research studies, and we have a number of safeguards in place to ensure that all of our conversations are confidential. Ireland is a small population, and while it's unlikely, it is possible that participants might know each other directly or indirectly. For this reason, ground rules will be established for the running of the focus group so that all participants understand that all conversations are confidential and the details should not be rediscussed outside the focus group in ways that might identify individual contributors. We hope to publish the results of the study in scientific journals, however, you will not be identifiable in any publication. We will anonymously acknowledge your help in the study in future publications.